Hello, everybody. Welcome to Practolytics, your healthcare partner. As promised, we are back again with another amazing series on routine food care services. This is a three-part series which will help you understand the basics, coding, billing guidelines, documentation requirements, and much more key components and key concepts that you have never ever heard. To begin with, this is Ellen Green from Coding Operations Practolytics, and I'm Certified Coding Specialist from AHIMA. Today, we will discuss about the CPT codes and the basic guidelines that are utilized in the routine food care services. With no further delay, let's just quickly begin the video. Routine food care services. What is a routine food care service? This is either clipping or trimming of normal or mycotic toenails, debridement of the toenails that do not have onchogryposis, shaving, paring, cutting or removal of keratoma, tiloma or heloma, and non-definitive shaving or paring of plantar warts, except for the cauterization of the plantar warts. All these are included here. Now, what does a routine food care service actually include? This includes cutting or removal, corns and callus, trimming, cutting or clipping of nails, hygienic and other preventive maintenances like cleaning and soaking of your feet. Moving to the CPT codes that are to be utilized for these services, let's learn what are those. Firstly, CPT 11719. Utilize these codes if you are just trimming the nails. That could be any number. And 11720. If you are performing a debridement, then utilize these codes if the nail number is between 1 to 5. If the debridement of the nails are more than 6, then utilize the CPT 11721. If a partial or complete nail plate avulsion is being performed, then utilize 11730. If you can see over the screen, there is another CPT 11732 with a plus symbol before it, which indicates that it's an add-on code and always has to be utilized only with appropriate and applicable primary code. Any additional partial or complete nail plate avulsions should be reported with CPT 11732. This is all about your nails. Now, moving on to the lesions. Trimming of a skin lesion has to be reported with 11055. Likewise, trimming of the skin lesions, if they are 2 to 4 in number, then CPT should be utilized is 11056. Likewise, trimming skin lesions over 4 has to be indicated with one single code, that is 11057. This is all about reporting the lesions. Moving on, generally, Medicare will not cover routine food care services, what we have discussed. But there are cases where they are payable. In order to cover it, it requires the patient either suffering from disease affecting circulatory problems or lack of sensation in the legs, feet. It could be warts, infections, ulcers, wounds and their treatment. Fungal treatment and presence of a metabolic, neurological or peripheral vascular disease. Then modifier Q7, 8 and 9 are required. Again, here comes the question. What are these modifiers and how to use this? No worries, I will tell you what are those. Q7 has to be utilized if you find 1 class A findings. Similarly, Q8 is for 2 class B findings. And then Q9 is for 1 class B and 2 class C findings. Are you confused or not figuring out what are these findings and how to use them or where to apply them, when to apply them, how to find out all these? No more worries. We are here to help you out. We will be coming soon with the part 2 in this series, which will help you understand all these questions. So in the meanwhile, please stay tuned to us. And thank you so much for your time. And in the meanwhile, if you have any questions, please do contact us.